AMERSA is a collection of the smartest, most charismatic, amazing people I've ever met. It has been the greatest honor of my life to work with these folks and be in the same room as them, as my heroes of addiction research and service.
It's an organization that's rich in nurses, physicians, social workers, psychologists, psychiatrists, and all of those disciplines working in the treatment and education around substance use and addictions issues.
It is an organization that supports a group of people who are all working towards the same very broad cause, which is to reduce the impact of substance use disorders and addiction on patients.
The fact that they're not only focused on research, but also in addressing different aspects of patient care, such as education, practice, policy level, is something that I found very intriguing.
It's really hard to describe how important it is and how much of an impact it's made on my professional life as well as my personal life. I've learned so much from an academic or professional standpoint, but I've also met wonderful people who have become friends, who've become colleagues, who I've collaborated with on research projects, on manuscripts, publications, and grants.
It's a unique environment of warm, welcoming, wonderful people who work every day and every night to improve our system of care.
One of the things that's special about AMERSA is that it's an organization which truly models multidisciplinary and interdisciplinary approaches to care. I could count on people from AMERSA to help me to solve huge problems. These individuals were available whenever I needed their help and assistance.
No matter what your training, what your background, what your discipline is, it's really a come as you are so that you can bring your own experiences to the group so that everyone else can learn from you.
AMERSA puts that into an educational scaffolding that allows a person to understand where all the disciplines are coming from to treat patients.
The collaboration among many providers in different disciplines and expertise, I just find nothing short of incredible. Again, when you build that on top of the commitment, the collaboration, and the people who you can leverage and ask questions of, how do we do this and what are we doing right? And more importantly, what are we doing wrong so we can learn from that is just a great opportunity to be a part of.
That AMERSA is person-centered first, always thinking about the person who they're treating and respecting their views, their rights. Even having me, a person in recovery, at the table was very important.
For those of us who worked in our institutions for some years, feeling like we were voices crying in the wilderness, that alcohol and drug issues were important to attend to. And then we went to AMERSA and found all of these other people who were having exactly the same experience in their institutions. And they had found various ways to address the problem.
If you want to find a place where you can not only inform research, but education, practice, and on a policy level, then AMERSA is that place for you.
We're going to be around for a long time, and we want everyone to be part of this.